When you hear the word inflammation, you probably think, well, something bad, right? A problem that needs fixing. But what if I told you it's not the villain of the story? What if it's actually one of the most sophisticated, high-stakes emergency response systems in the entire universe, and it's happening inside you right now? Let's dive into what is basically a microscopic action movie.
It all starts with something so simple, something we've all had happen, a tiny paper cut. It seems like nothing, doesn't it? But on a microscopic level, that little slice just triggered a full-blown, all-hands-on-deck emergency. It's a tiny drama of life and death, and we're going to follow the action from the very first moment.
So what is this emergency response we're talking about? Well, at its core, acute inflammation is your body's 911 call. It's the built-in, immediate system that's designed to react to any kind of injury or invasion, no questions asked.
The mission is pretty simple, but it is absolutely critical. Neutralize any bad guys, clear out all the damage, and kickstart the whole repair process. The entire system is built for one thing and one thing only: speed and efficiency. It's all about getting the cellular first responders to the scene of the crisis as fast as humanly or cellularly possible.
Now, we've all felt the results of this microscopic battle. These 5 classic signs, the redness, the warmth, the swelling, the pain, and sometimes even a fever, they aren't the problem itself. Nope. They're the physical evidence, the smoke rising from the battlefield that lets you know your body's defense forces are on the job, and each one has a very specific cause.
Let's connect the dots here, from what you feel on the surface to the crazy battle happening underneath. That redness and warmth, that's from chemicals like histamine, basically flinging the doors of your blood vessels wide open, rushing more blood to the area. The swelling? Same culprit. Histamine makes those vessels leaky, so fluid and immune cells can flood right into the tissue. And the pain? Oh yeah, that's chemicals like prostaglandins making your nerve endings super sensitive, kind of like a biological alarm system screaming, "Hey, protect this area."
Okay, but before any of that can happen, an alarm has to be sounded, a really, really loud one. The instant your tissue is damaged, a chemical cascade kicks off, sending out signals that are basically screaming for help across your entire system.
And the speed is just mind-blowing. Instantly, in the blink of an eye, specialized cells called mast cells basically detonate, releasing a flood of histamine. A split second later, a protein called Hegeman factor gets activated by the damaged tissue, setting off a massive domino effect of other alarm systems. Then, within minutes, your own cell membranes start releasing something called arachidonic acid, which gets turned into those signals that cause pain and call in the troops. It's a symphony of perfectly coordinated chaos.
So with the alarms blaring, it is time for the first responders to hit the scene. And I want you to meet the neutrophils. Seriously, you should think of these guys as the elite, door-kicking SWAT team of your immune system. They are the very first cells to answer the call, and they show up ready for a fight.
And just getting to the battle is an incredible action sequence all by itself. First, those wider blood vessels cause them to slow down and drift to the edges. That's called margination. Then, they start to kind of tumble and roll along the vessel wall, snagging on these molecular speed bumps. That allows them to grab on for dear life. That's adhesion. And then they do something just amazing. They literally squeeze themselves through the wall and out into the damaged tissue. From there, they just follow the chemical breadcrumb trail right to the source of all the trouble.
And when they get there, they do not mess around. Neutrophils are basically walking weapons factories. Their most powerful weapon is something called an oxidative burst, where they essentially create household bleach to just obliterate any bacteria or debris in their path. It is incredibly effective, but it's also really destructive to everything around it. Their job is search and destroy, period.
But here's the thing. These elite soldiers are designed for a short, violent mission. They're like cellular kamikazes. Their intense attack creates a ton of mess, so after about 24 hours, they undergo programmed cell death, or apoptosis. This is a crucial step. They complete their mission, and then they get themselves off the battlefield to make way for the next phase of the operation. So, after that initial shock and awe campaign from the neutrophils, a new cell arrives. This is the macrophage. And if neutrophils are the SWAT team, you can think of macrophages as the on-site commanders and the professional cleanup crew, all rolled into one.
And the difference in their roles is just night and day. Neutrophils are all about speed and overwhelming force, right? They show up in hours, and they're gone in about a day. Macrophages, on the other hand, they arrive a couple of days later, and they are in it for the long haul. Their job isn't just to kill,
It's to clean up the mess, including all those dead neutrophils, and, most importantly, to decide what happens next.
And this right here is the critical turning point in the whole story. The battlefield is pretty much secure. The first wave of invaders has been neutralized. So the macrophage is now standing in the middle of all this debris, and it holds the future of this tissue in its hands. It's at a crossroads, and it has a big decision to make.
And it has 4 main paths it can take, a decision that dictates everything that follows. Ideally, if it senses the threat is gone, it releases powerful anti-inflammatory signals to start the healing process. But if it finds lingering bacteria, it can call in for backup, meaning more neutrophils to continue the fight. If the threat is something it can't kill, like a splinter, it'll just wall the whole area off, forming an abscess to contain it. And in the most serious cases, it can escalate the war, taking a piece of the enemy to the wider immune system and kicking off chronic inflammation. The macrophage is literally directing this whole show.
So let's assume our macrophage made the right call and gave the signal to start healing. Well, now the entire operation shifts. The demolition phase is officially over, and a massive construction project begins. The goal now? Rebuild what was broken.
The very first step in rebuilding is creating something called granulation tissue. The best way to think of this is like the initial, kind of flimsy scaffolding on a construction site. It's a messy mix of new, tiny blood vessels snaking into the wound to bring in supplies, and the all-important worker cells called fibroblasts. These are the construction workers of the cell world, and they're about to lay down the foundation for the new structure, collagen.
Now, at first, these fibroblasts just slap down a quick and dirty fix. It's called type 3 collagen. It's pretty weak and disorganized, but hey, it fills the gap fast. Then, over the next few weeks, and sometimes even months, the site gets a total remodel. A special enzyme comes in, tears down that temporary scaffolding, and replaces it with organized, super powerful type 1 collagen. We're talking about the same stuff found in your bones. It's a structural upgrade from a temporary patch to a permanent, reinforced repair.
But you know, any huge construction project needs raw materials. And this is where it gets really practical for us. The whole process relies on a few non-negotiable nutrients. You need vitamin C just to forge the collagen chains in the first place. You need copper to create the strong crosslinks that make the structure stable. And you absolutely need zinc for that critical enzyme that remodels the weak scaffold into a strong scar. Without these key materials, the entire healing process can just grind to a halt.
So when you step back and you look at the whole sequence, from the first chemical alarm to the neutrophil assault, the macrophage cleanup, and the final rebuilding, it is an absolutely breathtaking symphony of cellular cooperation. It's a system that's been honed by millions of years of evolution to defend, demolish, and rebuild with incredible precision. And yet, the end result is often an imperfect patch, which leads to the final question. If this process is so perfect, why does it leave a mark? Why do we get scars? It's a pretty good reminder that even in the most elegant biological systems, survival often prioritizes strength over perfection.